Hello and welcome to United Insurance Brokers. Thank you for your interest in the career agent opportunity focused on Medicare products. Within our Medicare products division, our focus is on Medicare Advantage prescription drug plans and also standalone prescription drug plans in key markets throughout the country. So essentially, in order to pursue that path as a career agent with a very specialized niche focus, handling Medicare products, you would of course need to be a licensed insurance agent and ideally have your life and health license, but at the very least you would need health. That's in some states referred to as disability, would need to cover health products. Many of you may already have that license. If not, there is a process to go through, and typically you can obtain your insurance license within 2 to 4 weeks depending on state requirements, which varies quite a bit. Sometimes you would have a class type environment, sometimes it's more of an online environment, followed by an exam. In any case, there would be an exam if you're not licensed yet, and a lot of very successful agents have started with no license. They secure their license for this opportunity or for other opportunities out there and become licensed specifically with that intention in mind, and within 3 or 4 weeks have an insurance license. So once you're a licensed agent, or if you already are, the next step would be to pursue becoming certified to be able to market Medicare Advantage plans. It's a very regulated niche industry, and based on the fact that the products that we're offering to consumers who are Medicare eligible consumers generally have a zero premium or a very low monthly premium. So essentially, Medicare Advantage focused agents are selling a product that in most cases would have, and it depends on market and area, but a zero premium. So to think of being able to be in a sales type opportunity with all of the very lucrative financial rewards that go along with that, and to be able to offer a product without a premium, with a zero premium. It's not really without a premium, there's a premium, but the premium is in so many markets zero. In other markets it may be, for example, $10 or $20, $30 a month. So we're talking a relatively low premium or a zero premium product, and essentially what this is privatized Medicare. So what will happen when a Medicare eligible consumer, for example someone that's over 65 that's enrolled in Medicare and has Medicare Part A and B, for example, they have the opportunity to enroll at certain times of the year or based on certain events, which of course full training is provided in how this is approached. They have the opportunity to enroll in a Medicare Advantage type plan, and that Medicare Advantage plan, which would be considered Medicare Part C, what it basically does is offers an alternative to traditional Medicare. Traditional Medicare, while it provides many great benefits, has its share of limitations. With Medicare Advantage plans, the benefits are a lot more manageable, many people find. So for example, when you enroll in a Medicare Advantage plan, our focus carrier is United Healthcare, by the way, which is just a fantastic insurance company I'm sure you've heard of. They handle many markets, many types of insurance products. We focus on Medicare products with United Healthcare. So, for example, when a Medicare eligible consumer enrolls in a Medicare Advantage plan, and in many cases the premium is zero, they would receive a card from United Healthcare that they would present to their doctor. So instead of showing a Medicare card, which many of you may have seen, they would show a United Healthcare card essentially, which would have all the proper ID numbers for medical care and also prescription medication, for example. So that's kind of how the process works. Now the advantage is there are various enhancements to the benefits, and in terms of in some markets there may be the copay to see a primary care doctor may be as low as zero, or it may be $5 or $10, for example, rather than paying 20% of the bill. As an example, you might pay $5 to see a primary care doctor. For a specialist, you may hypothetically pay $20 flat fee instead of paying a percentage. If you go to the emergency room, instead of paying a percentage and having a deductible, you may pay a flat $50, for example. So it does vary. The reason I'm using a lot of for examples is it really does vary by market, by state, and within the state, by area, by county, etc. There's a lot of variance in plans. So the area that you're specifically in, if you decide to pursue becoming a certified Medicare Advantage agent, being able to sell this highly specialized product niche, you would learn the products in your market because they do vary. And you may be in a market where it's a zero premium Medicare Advantage plan with very low copays to see doctors and for emergency room visits and even hospitalization stay, and low copays on medication. And in other markets, there may be a small premium. It could be $10 or $20 or $30 or $40 per month. But the benefits, of course, are more defined benefits in terms of participation in the costs, how much you pay to see a doctor or a specialist, or to go to emergency room, or hospitalization, or medication. Usually medication's broken into different tiers, whether it's generic or name brand, etc. So in any case, there are a number of enhancements, and so many people around the country, throughout America, have Medicare Advantage plans and have for a very long time. This is really nothing new. What is new is that 1 out of every 3 Americans are turning 65 over the next several years. It's a massive growing market. Every day, thousands and thousands of people have a birthday, and that birthday is turning age 65, which creates a window of opportunity when they're able to enroll in a Medicare Advantage plan. Also, every year there's an annual enrollment period where people that are eligible for Medicare can change plans or enroll in a Medicare Advantage plan. There are also special circumstances throughout the year, such as people with certain levels of low income can enroll year-round, for example. So there's quite a bit of opportunity. One area is everyone turning 65. One area of opportunity is the annual open enrollment period, which happens every year for Medicare Advantage plans and Medicare Advantage prescription drug plans. And also there are special situations, for example, lower income I mentioned earlier, or when moving from one service area to another, there are certain types of opportunities that allow Medicare eligible consumers to enroll in a Medicare Advantage plan. And the benefits are just great. I wish I had one of the Medicare Advantage plans myself, because in my particular case, in my area, if I had the Medicare Advantage plan, I would have much stronger benefits than I have now, and I wouldn't pay hundreds of dollars a month. I would pay zero, and not only would I pay zero, but I'd have much better health benefits than I do currently. So really, depending on area, the benefits vary, but they're great benefits. And essentially, this is the ultimate sales opportunity, because you don't really sell. It's not about talking people into something. It's really about providing an option and letting the Medicare eligible consumer make an informed decision that's good for themselves. And if they choose to enroll, facilitating their enrollment and following the proper steps. There's a lot of state-of-the-art automation that goes into this, so it's a very streamlined process. There really aren't any health questions. There are just a few questions. So we're talking about a low premium or zero premium product with very few questions and a very streamlined enrollment and a very fast approval process. So it's all very, very streamlined. Now, one of the great things about it, one of the great favors that the United States government did to agents throughout the country many years ago was essentially to mandate the way that commissions are handled with Medicare Advantage plans. And the reason that was done was not just to make sure that agents make a lot of money. That may have been part of the reason, not that I know of. The reason was to make sure that there wasn't something called churning. Churning is when agents would essentially change plans, encourage members to switch from one plan to another every year in order to earn a higher commission, which really is not an ethical way to do business. And there was a lot of that going on when Medicare Advantage plans were newer into kind of the landscape of insurance in America. So as things evolved, there was deemed to be this need to kind of levelize things. So essentially what happens, there's a first year commission, which is quite large depending on what state you're in. There's a little variance, but approximately $400 to $500 for most sales would be the initial commission for someone that's enrolling in a Medicare Advantage plan for the first time. And the great thing about it is the renewal, which is where agents have historically been known and currently known to make most of their income, really comes from renewals. So the great thing about Medicare Advantage products is the renewal is approximately 50% of the first year commission. So hypothetically speaking, if you earn a $500 commission making one sale, your renewal commission would be $250 per year that continues in force, and the retention tends to be very strong. So you're receiving roughly half of the first year commission on an ongoing basis. So let's say that you sell 10 of these policies at $500 commission each, that's $5,000, and that's $2,500 a year renewal. Now let's say that you sell 100 of these products. In that case, you're looking at approximately $50,000 in first year commission in this example, and $25,000 year renewals. So let's say you do that for 2 years. Now you've made $50,000 year one, year two you make another $50,000, you're receiving $25,000 in renewals from the previous year. Then as you go into the next year, you're up to around $50,000 in renewals. So you do this for 4 years, and let's say you're selling 100 per year, you're making $50,000 a year. You do that for 4 years, you've made about $200,000 in 4 years, and your renewals are approximately $100,000 a year potentially. So the 50% renewal is just huge. And some agents will sell 200-300 plus per year Medicare Advantage plans, and a lot of it is done during the annual election period where members can change plans, and a lot of it happens throughout the year for people turning 65. There are also special needs plans for those that are eligible for Medicare and Medicaid both, or that have certain chronic special needs, such as they're called chronic special needs plans. In different markets, there's a variety of different types of plans for certain reasons with special enrollment opportunities. So there's quite a bit to this, but just to focus on the main core focus of the product line itself, really it's people eligible for Medicare. It's not always people that are over 65. In some cases, people that are younger, based on having, for example, a disability that would qualify one for Medicare, may be able to enroll at a younger age. I personally enrolled Medicare eligible beneficiaries, as they're called, in their early 20s, for example. So it really is a great income, and the renewal is what makes it incredibly huge. Now you do need to remain licensed and certified with the insurance company, which happens every year, to continue to receive those renewals, which is, it's not really a big deal. It's something the first time you do it, it's kind of intensive. The certification process may take you a few weeks online to go through an online course. But once you pass it the first time, every year, it's quite a bit simpler because you already know the material, and there are some changes year to year. But every year you recertify, and that's essentially how it works. So this is the opportunity. Now we do provide comprehensive training, and we operate really in predominantly a virtual environment, but we do connect you with local United Healthcare facilities in your area, where you have the opportunity to meet with local United Healthcare managers and personnel that provide various types of support, which varies by area and your proximity to an office, where you can go to, for example, group training sessions and other types of opportunities. In some cases, there are opportunities to sign up for a kiosk space, for example, at a major retailer. And I won't mention the names because it kind of changes over time, but there are some alliances with certain retail chains where there's actually a branded booth, and agents sign up for slots and sit there, and people will approach the agent and ask questions, and you can enroll Medicare beneficiaries based on that approach. Now, this is not something that is traditional sales. There's no pressure. There's zero pressure. It's almost reverse pressure. So we do not talk people into enrolling in these products. As mentioned earlier, we just offer the opportunity and the option and explain it, and it's more of a providing education in a sense on how the product works and how the benefits work, and letting the consumer make a very, very objective personal decision on what's best for them. You're not allowed to cold call, so you won't have to cold call, and furthermore, it's illegal to cold call. So the marketing is there's very specific ways to market. One of the paths is direct mailing campaigns for people turning 65, for example. There's another opportunity which would involve retail sign-ups for these kiosks we mentioned, and there are a lot of other paths, including sometimes the opportunity for leads that may come through United Healthcare different regional offices depending on where you're located, and there are other ways to generate opportunities as far as marketing. You can actually schedule approved educational meetings, for example, and approved sessions where you have an opportunity to have a group type of a meetup. Now, depending on when you're watching this video, kind of the new normal has had an impact on things. So there's, of course, social distancing and everything that needs to be considered in light of world affairs and pandemic. So bottom line, though, is you're able to have approved types of meetings where invitations go out to people that live within a certain vicinity, and they're invited to a group discussion where you will be able to present the product to a group of people. And that's another great opportunity. There's a lot of support available for that. So there's lots of ways to make sales. So basically, this is an opportunity where you would be an independent contractor. You're definitely self-employed, an insurance agent, paid on commissions based on the number of enrollments, and paid directly by the insurance carrier. So this is not a situation where you're paid by a third party. You're paid directly by the insurance company. Your contract is directly with the insurance company. You would have an appointment with the insurance company. The insurance company would pay you directly by direct deposit. They pay your renewals. You own your own book of business, and you receive the full commission that you should receive based on what's approved. And the commissions are approved every year based on various guidance from CMS, which you may or may not be familiar with, which is essentially the federal government. So over the years, commissions have gradually increased. They really haven't decreased. They've really increased. And so it's very lucrative. I know and work with a lot of agents who have done extremely well, making as much as in excess of $200,000 per year in new commissions plus renewals. One of our agents from the past has sent me a picture, a selfie in his Lamborghini, which I hope he's not driving to his appointments. And he had his son in the car seat on the side with the convertible top down. Of course, that's not going to happen to everybody, but started from scratch 5 or 6 years later, that's where he's at. It is a good opportunity. Why would you decide to move forward? Well, timing is very important. Every year in the annual open enrollment period, where people that are eligible for Medicare can make changes, is a time when a vast majority of sales are made in a very condensed period of time that's approximately 2 months. So it's very common to see agents that are successful selling a few hundred Medicare Advantage products within just a few month period of time, which is a substantial amount of revenue. And there's also sales that can occur throughout the year. So based on the timing, it does take a little bit of time if you're not licensed to get licensed. If you are licensed to get certified next, that's the next step with the insurance company. And once you're properly certified, then at that point you're able to learn and train and start learning how to market these products and how to handle kind of all the streamlined enrollment methods. So timing is a bit important. You don't want to miss that annual window. If you miss it by a week, that's fine. You can still do things year round, but you're going to look forward to that once a year, super incredibly busy time of year when everybody in America that has Medicare has opportunities to make changes. You don't want to miss that. So timing wise, it is important. If you decide to move forward, go ahead and do it. Get certified, get ready, get prepared. You can't do this at the very last minute, because it becomes at the very last minute, there's just the support kind of dries up. Everybody's focused on enrollments and serving the needs of beneficiaries, including the insurance companies. They're all staffed up, and they're staffed up on enrollments, and supplies are backlogged. So you kind of have to get an early start and be really prepared early on. And then it is a year-round opportunity as well. So in terms of aligning with United Insurance Brokers, we've been around a long time. We have a very solid reputation. We really empower you as the agent in such a way that you're definitely not micromanaged. You own your own opportunity. We provide coaching and guidance. We connect you with brilliant minds and veteran agents from around the country, and provide just a ton of very unique proprietary support, both internally and through external channels. And really, you're in a position where with United Insurance Brokers, you own your own opportunity. We're there for you. We're supportive of you. At the same time, you don't have someone calling you saying, where are your sales today? Where are you right now? This is your opportunity. It's your business. We're there as your coach and your mentor. And keep in mind, that doesn't cost you anything. You'll never pay us anything. There will be no deduction from your commission. We're simply here to help guide you in a compliant path forward and to provide resources and support. So if you're interested in taking the next step, there should be a link that you can click on to express your interest in moving forward. And at that point, we'll provide more direct, meaningful information information to you. I really do appreciate your time. I hope you found this helpful. And the one last point I want to make is that in terms of timing goes, right now in America, of course, health is on everybody's mind, probably more than it ever has been during our lifetimes. And it certainly is a great time to get into the kind of the health industry sector if you're not already there, and specifically a product that is not costing members a lot of money to sign up for. So you're offering a product that's helping people, that's affordable, that's streamlined, that asks very few questions, and that's processed very quickly, and that actually makes a very meaningful difference in people's lives. So thank you so much for joining this discussion. Wish you the best. Take care.